Hello everyone, welcome to the video on antidepressants. In this video, we'll see the pathophysiology and drug treatment of depression. Now before getting into that, depression can be classified into three types: unipolar, bipolar, and dysthymia. Now unipolar is a persistent depressive state, whereas bipolar, as the name indicates, it has got two different characteristics. Depression will be there, and which is followed by mania. So these are two different extremes, hence the name bipolar. The other one, dysthymia, is nothing but chronic depression. The depression goes for long term, years together, then it is called as depression. Now let us understand the pathophysiology of depression. See, the major depressive disorder, when you see the pathophysiology, there is a theory which explains about the depression. It is called as monoamine deficiency theory. Now in the brain we have certain neurotransmitters which contains a single amine group in their structure, like serotonin, norepinephrine, dopamine. These neurotransmitters are called as monoamine neurotransmitters. Now according to one theory, in the brain, decreased levels of monoamine neurotransmitters is what is causing depression. This theory is called as monoamine deficiency theory. Now this, according to this amine hypothesis, see, reserpine some time ago it used to treat hypertension. So when reserpine is used, it depleted norepinephrine, serotonin, dopamine, and it has caused severe depression. And the use of reserpine has led to hypothesize that the deficiency of these three neurotransmitters, these monoamines, is what is causing depression. So the acute mechanism of antidepressants to treat this depression, increased levels of norepinephrine and increased levels of serotonin drugs are treating depression. But remember, antidepressant effect, it takes at least several weeks to get that antidepressant action. So the basic job of antidepressant drug is to increase the levels of these monoamines. Now see, the treatment could be of two types. One, non-pharmacological, and the other one is pharmacological treatment. See, non-pharmacological treatment, physical activity will enhance neurotransmitters. Especially the clinical research has proved that physical activity has increased the levels of serotonin. The naturally increasing neurotransmitter level is possible with physical activity. Now proper diet, like good healthy habits, will also help you combat depression, and psychotherapy, which is nothing but counseling. When people talk about their depressive episodes, that helps a lot. The other one which we are going to see is about pharmacological medication. Now serotonin has got major role in depression. So increased levels of serotonin is possible by using drugs like selective serotonin reuptake inhibitors. Whatever the serotonin is released is reuptaken by certain transporters. If you inhibit the transporter, the levels of serotonin will get increased. They are popularly known as SSRIs. The next one is monoamine oxidase. Monoamine oxidase is a metabolizing enzyme which acts on monoamine neurotransmitters. So when the enzyme is inhibited, the neurotransmitter levels will increase. The last one, tricyclic antidepressants. Some time ago these were the very popular group, but nowadays the use of TCAs is reduced because of their adverse effects. Let's get into the drugs. So this is what. So depression is characterized by persistent sadness and loss of interest. And one of the theories suggests that, monoamine theory suggests that the decreased levels of serotonin, norepinephrine, dopamine is what is causing this problem. So the major classes are SSRIs, and serotonin norepinephrine reuptake inhibitors are also there. Now the next class is monoamine oxidase. Now monoamine oxidase, we have two different types are there, non-selective and selective. So there are two families of monoamine oxidases are there, monoamine A and monoamine B. Monoamine B is very selectively enhances dopamine, hence it is used to treat Parkinson's disease. Example of the drugs, salicylic, rasazyline. Whereas monoamine AB, the non-selective drugs like isocarbazate, phenelzine, tranylcypromine, they increase all the neurotransmitters, monoamine neurotransmitters, hence they can be used to treat depression. So these are all the major classes. Now let us understand about SSRIs. See, these are the very popular group which are used to treat depression. The drugs like fluoxetine, paroxetine, sertraline, citalopram, fluoxamine are used. The major mechanism is they block reuptake of serotonin. They are used to treat major depression, obsessive compulsive disorder. Bulimia is a disorder which is characterized by binge eating and vomiting. Binge eating and vomiting. This is a kind of neurological disorder which can be treated by SSRIs. Now, some of the anxiety disorders can also be treated. And premenstrual dysphoric disorder, this can also be treated by SSRIs. Now, the major side effects, they cause anxiety, agitation, bruxism, sexual dysfunction, and weight loss. Now, understand whether you increase 5-HT-serotonin or dopamine levels, they will cause these kind of adverse effects. Anxiety, agitation will be increased. Now, the major toxicity with this is serotonin toxicity syndrome. It is known as serotonin syndrome. Serotonin syndrome occurs when SSRIs are used along with monoamine oxidase inhibitors, or SSRIs are used along with tricyclic antidepressants. Any two classes of antidepressants are used together, then it may cause serotonin syndrome. What happens in the serotonin syndrome is, it is because of increased levels of serotonin. The symptoms are sweating, rigidity, myoclonus, hyperthermia, increase in temperature, and ANS instability, and it may also cause seizures. So, two combinations should not be used because it may cause serotonin syndrome. Moving to the next group, tricyclic antidepressants, amitriptyline, imipramine, clomipramine. They non-specifically block serotonin as well as norepinephrine reuptake. They can be used, the major uses are, they can be used to treat major depression, phobia and panic anxiety stress, OCD, obsessive compulsive disorder, neuropathic pain, and enuresis. Now, adverse effect, the major problem is they block muscarinic as well as alpha receptor blockade. The other toxicities, which is commonly known as 3Cs, coma, convulsions, cardiotoxicity is there. Because of these extensive toxicity, these drugs are not preferred nowadays. Now, drug interaction, hypertensive crisis with monoamine oxidase inhibitors. See, high levels of norepinephrine increase will cause hypertensive crisis. Serotonin syndrome, as we have seen just now, when two groups of antidepressants are used together, they will cause this antihypertensive syndrome. So, TCAs, as I told you, nowadays they are not widely preferred because of their extensive adverse effects. Now, the last group, monoamine oxidase inhibitors, like phenelzine, tranylcypromine, they non-specifically block monoamine A, monoamine B. They are used to treat atypical depressions. Drug interactions, the major one is serotonin syndrome. When they are used along with SSRIs or TCAs or meperidine, they will cause serotonin toxicity syndrome. Now, increased levels of norepinephrine will cause hypertensive crisis that include increases blood pressure, increase in arrhythmia, excitation, and hyperthermia. Now, the other antidepressants like trazodone is associated with cardiac arrhythmia and priapism. Now, venlafaxine is known as SNRI, Selective Norepinephrine Serotonin Reuptake Inhibitor. Now, bupropion. Now, venlafaxine is non-selective reuptake blocker which do not have ANS side effects. Now, the next one, bupropion is a dopamine reuptake blocker. It is selective towards dopamine, which is used in smoking cessation. Now, mirtazapam is alpha-2 antagonist, which is associated with weight gain. So, this is about antidepressant treatment. Thank you for watching this video. If you like the video, do subscribe and share.